Now, in the second section of adenoidectomy, we will discuss some procedures that are used for the removal of the adenoid. What are the steps of the procedure known as adenoidectomy, and then what's endoscopic adenoidectomy. So we know now that adenoidectomy is the removal of the adenoid tissue which is present in the upper part of the throat behind the nasal cavity. Steps of operation: Boyle-Davis mouth gag is inserted. That's the Boyle-Davis mouth gag. Before the actual removal of adenoid, examine the nasopharynx. So before starting the procedure, examination of the nasopharynx should be done. Nasopharynx is examined by retracting soft palate with curved end of tongue depressor. By digital palpation. So we can do it by compressing the, retracting the soft palate with curved end of the tongue depressor, and also by digital. We can palpate or feel by the fingers. That's the digital palpation or digital examination. Nasopharynx examination, that's the mirror that can be used for the nasopharynx examination to confirm the diagnosis, to look for the adenoids which are hypertrophied. It's very important that we should do this before actually starting the procedure, to look for the enlargement of the adenoids or what are the problems associated with the enlarged adenoids. So to confirm the diagnosis and to assess the size of the mass, how big the enlarged adenoids are. To push the lateral adenoid masses towards the midline. So we can push them towards the midline which are present on the lateral side. Lateral side is the side away from the midline. So any adenoid masses which are present on the lateral side should be pushed towards the midline for the easy access and easy removal. A laryngeal mirror, that's the laryngeal mirror, helps to assess size and extent of adenoid mass. Steps of operation. You can see that's the adenoid tissue that needs to be removed with the help of the curate. Proper size of adenoid curate with the guard is used for the procedure. Introduce into the nasopharynx till its free edge touches the posterior border of nasal septum. Press backward to engage adenoids. Head should be slightly flexed to avoid injury to odontoid process. So very important, use the correct size of the curate for the removal of the adenoids, which is introduced in the nasopharynx. That's how it is introduced, entered into the nasopharynx, until the free edge feels the posterior border of the nasal septum. Here the posterior border of the septum. Press backward to engage adenoids. We are engaging the adenoids, you can see, and it's pressed backwards. Head should be slightly flexed to avoid injury to the odontoid process. With gentle sweeping movement, very gently sweeping movement, adenoids are shaved off. So adenoids should be removed by the gentle movement. Lateral masses are similarly removed with smaller curates. Small tags of lymphoid tissue left behind, removed with punch forceps. So it's better try to remove all the lymphatic tissue, all the masses until it's all gone, because those small masses which are left behind, they can go hypertrophy, they hypertrophy and cause the complications. So look for all the masses which are present and try to remove them with the punch forceps. Take care not to injure the pharyngeal ends of eustachian tubes that are connect the throat with the middle ear and the throat and the nasopharyngeal end of the eustachian tube. It's very close to the adenoids. That's why the enlarged adenoids can cause obstruction of the eustachian tubes also. So we need to be look very carefully for the end of the eustachian tube. Hemostasis achieved by packing area for some time. It's a raw area. It bleeds usually for a few days and needs to be packed for some time to apply some pressure so it should avoid the massive bleeding that can occur, but once it stops, usually a small amount of blood comes up combined with the saliva and in the spit. So hemostasis should be achieved by the packing or applying the pressure. Persistent bleeders are electrocoagulated under vision. So people who bleed more, they are bleeders or they have some disorders, bleeding disorder, which is a contraindication. But if the people are or patients who bleed more, they need to be electrocoagulated under the vision. If bleeding is still not controlled, post-nasal pack is left for 24 hours. That's important. Post-nasal pack will apply the pressure, should be left there for 24 hours, so bleeding should be stopped. Other techniques of adenoidectomy that can be used, we have suction, coagulator, diathermy by the touching the hot end, diathermy and burning or removing the adenoids. Endoscopic transnasal or transpalatal adenoidectomy with microdebrider. Coagulator plasma field device. Endoscopic adenoidectomy under the endoscope visualization. Adenoidectomy can be performed. That's the step A. And then we have endoscope. Then through the endoscope, the curate is inserted and then the adenoids are removed by using a debrider under endoscopic control. So more visualization can be achieved with the help of the endoscope. So that was all about different endoscopic, different procedures performed for adenoidectomy, and it's under general anesthesia. Position is supine position, and the curate can be used for the removal of the endoscope. Adenoidectomy and endoscope can also be used for the adenoidectomy. Thank you for watching sqadia.com.